Hello students, welcome to our channel Pharmacology. Today we are going to discuss about one of the important lesion of skin that is called pemphigus. You all know pemphigus is one of the most important topic that is asked as a long note question or as a short note question in your third year oral pathology and in the MBBS second year pathology in the lesion of skin. According to the term given by the Witchman in the 1791, in the pemphigus every word has a meaning and it is very important for you to understand. The term was given by Witchman in the year 1791. It's a Greek word that means pemphix. There was a Greek word that means pemphix, and according to pemphix, the meaning of pemphix was blister or the bubble. Pemphigus is an autoimmune disorder. You all know what autoimmune means. Autoimmune disorder means any disease or disorder that is caused because of our own autoimmunity. Means our body is making antibody against the self cell or the self substances. According to the book Schaeffer's or the Nils, that it is a vesicobulous lesion. You must be thinking, what is vesicobulous lesion? Yes, vesicobulous lesion, you should divide it into two parts, the vesico and the bullous. The vesico means any vesicle like, any small fluid filled blister like, or the bullous means large lesion. Now, the disorder pemphigus has a specific definition. The definition of pemphigus is a term given by Witchman Greek word. We all have to mention this in introduction. In the introduction part, you will write the definition as it is a serious, very serious, chronic, acute or chronic, then it's a chronic disease characterized by the appearance of vesicle or the bulla. Vesicle or bulla. Bulla is a large lesion, vesicle is a small lesion filled with fluid. A small or large fluid filled lesion that develop in cycle. Means in a small cycle, sometimes the smaller lesion, sometimes the larger lesion, they appear. So the full definition will be serious chronic disease characterized by the appearance of vesicle or bulla, which is a small or large and may be fluid filled lesion that develop in a cycle. Now, there are two types of skin lesion, intraepithelial or the subepithelial. What is intraepithelium? Intraepithelial means beneath the epithelium and subepithelium means over the surface epithelium, means ऊपर से हो रहा है या फिर अंदर हो रहा है, means inside the dermis, means intradermal or subepithelial. Then the intraepithelial lesion will be pemphigus, and later we will be discussing one of the lesion that is pemphigoid, and that will be the subepithelial. The intradermal lesion or intraepithelial lesion, what it is, which antibody? We have talked about autoimmune, then which antibody is forming? IgG and IgGA antibody are directed against the surface keratinocytes, surface cell keratinocytes, keratin and cyte, keratin producing cells. Now, in the latter we will discuss what keratinocytes and what are the meaning. Now come to the types of the pemphigus. Pemphigus has following types. They are Pemphigus vulgaris, Pemphigus vegetans, Pemphigus foliaceus, Pemphigus erythematous, and paraneoplastic pemphigus. Out of these, Pemphigus vulgaris is most common, and in the long question you will be attempting Pemphigus vulgaris. Now, the Pemphigus vulgaris. Now, the Pemphigus vulgaris. The Pemphigus vulgaris, one of the type of pemphigus, It is characterized by vesicle or the bullae of different sizes. Now the etiology. What are the etiological factors? One etiological factor we have discussed is the autoimmune disorder. Every student will be writing about the autoimmune disorder. If you are going to write a drug that is associated with the Pemphigus vulgaris, then you will be fetching more marks. So the drug penicillamine is one which is associated with the Pemphigus vulgaris. Now come to the etiological part, what and how. You must ask in every question or in every study what and how. Now we have told it's autoimmune disorder. How? How the body is producing the antibody and how it is acting. The autoantibody IgZA and IgZZ already discussed is produced against our healthy protein, and that is creating a space. In that space the fluid is being filled and that is converted into the blister or the vesicle. Now in detail I am going to make you understand. Listen one very carefully. The IgZA and the IgZZ antibody are formed which is going to affect the keratinocyte cell. Now the keratinocyte, what I have already told you that we will discuss later, that keratinocyte. So they are going to affect the keratinocyte cell. Those keratinocyte cell contain two protein, that is desmoglein 1, desmoglein 3 and desmoglein 4. These are the protein which are required for the cell to cell junction, that is desmosome formation. What is desmosome? The role in the desmosomes are the junction between the two cell. Two cell are interconnected with desmosomes. There is so desmoglein 1, desmoglein 2 produced by the keratinocytes have role in the desmosome formation, that is cell to cell junction. Now what is happening when the IgZA and IgZZ is affecting the keratinocyte cell? So the desmoglein 1, desmoglein 3 and desmoglein 4 are being affected, so the antibody is going to bind with the desmosome, so cell to cell adhesion is lost. Don't move in the direction, listen my words. So cell to cell adhesion is lost. Once the cell to cell adhesion is lost, then a space is created. Think one thing, then there are two banana, okay, and if you are separating the two banana, then what will happen? There will be a space will be created, so the space will be created. In the scientific term, the called cleft. Cleft is a what? Between the mountains, when a space is present, that is called cleft. Cleft palate, cleft tongue, cleft mouth. So this is cleft palate, cleft lip. So in the cleft, from the extracellular site, the fluid comes and fluid is filled. You should ask yourself from where the fluid is coming. So from the extracellular site, the fluid is coming, and that is called as, that is forming the vesicle, bulla, blister, and then finally the ulceration occur. What happened, one thing also, that is, since the antibody is binding to the, since the antibody is binding to the desmosome, so cell to cell junction is lost, yes, but also the cell morphology is lost. Since there is a space is created, so cell lose their adhesion. If think, if anything is binded tightly, ठीक है, then it will be tightly, highly tight, but once they are loosed, so there will be loosen cell with loosen morphology. Loosen cells with loosen morphology is called as the acantholysis. What? It is called as acantholysis. So these all are the thing that we have discussed. Once quickly revise, what is pemphigus? Pemphigus is a term given by the Beachman. Pemphigus is a term given by Beachman, and it's a Greek meaning word that means pemphigus, blister or bulle. It's autoimmune disorder, vesicobulous lesion. Blister is what? Elevated lesion with fluid, and pemphigus is a serious chronic disorder which is characterized by vesicle or bulle. It is a small or large, or it is intraepithelial in nature. Don't go for the subepithelial. Then antibody is produced. Types of vesicle or bullae, that is vulgaris, vegetans, foliaceous, erythematous, paraneoplastic. Then we discuss about the pemphigus vulgaris, that is vesicle bullae of varying size. Then we go for the etiology, in which we discuss two etiology, that is autoimmune disorder and the drug penicillamine. The autoimmune disorder, we discussed in detail how the autoimmune disorder is going to cause pemphigus, that is skin disorder. In the etiology, we discussed that IgG and IgG antibodies affecting the keratinocyte cell, which is further very beneficial for the desmoglin 1 and desmoglin 3, which has role in the formation of desmosome. So once the keratinocyte cell is affected, so the antibody is going to bind with the desmosome and cell to cell junction is lost, so the space is created, and hence a cleft is formed in which there is fluid is filled from the extracellular fluid area, and vesicle bulla or blister is formed, which finally ulcerate. Along with the cell to cell junction loss, this means loosen cell, and also the morphology is lost. This is called as acantholysis. This has a special viva question. There is, what is difference between the acanthosis and the acantholysis, which will be discussed in the latter, in the final lecture of pemphigus. You must be able to answer the viva question. So this was all about the pemphigus vulgaris and pemphigus. So guys, if you like my video, then please like, share and subscribe my channel. In the part 2, we will be discussing about the clinical feature, their differential diagnosis, their histopathological feature, and finally the treatment plan. So this was all the skin lesion pemphigus. Very important, very important. So please watch the video carefully once, twice, and try to understand the things. Thank you. That's all. If you like my video, please like, share and subscribe. Pharmacology Adda. Thank you. For notes, you can connect to my WhatsApp in the description, and also on my Instagram ID Pharmacology Adda. Thank you. That's all.